In this video we are going to discuss about child health nursing subject. In that one unit, that is the fourth unit, disorders and health problems of a child. Okay, in this one disease condition is there, that is the helminthic infections. Okay, it is one of the disorder for the children. Okay, it is there in the child health nursing subject for the GNM second year students. Okay, in this it is one of the common problem. Helminthic disease is a common problem for the children. Okay, especially the children will be prone to get this type of infection. Okay, next in this it will be caused, how the disease, how the helminthic infections will be caused to the children's means. In this the disease will be caused to the improper disposal of human excreta. Okay, improper disposal of human excreta. Human excreta nothing but waste products, wastage from the human body. Okay, which is the human body will be excreted out as like waste products. Okay, that wastage will be unsafe disposable. Okay, there is no hygienic practices for excretion of stool. Okay, due to this the children may be affected by this problem of helminthic infections. Okay, in this what happens means it will mainly found in the human beings, that is the due to the roundworms and pinworms and hookworms. Okay, especially the helminthic infections will be caused by the roundworms, hookworms, pinworms and tapeworms. Okay, these are the worms will cause the some infections to the human body, especially in the children's. Okay, next we are going to discuss about roundworms. Okay, in this roundworms what type of disease will comes to the children's means, especially the roundworms will cause the ascariosis. Okay, especially the roundworms will be lives in where we are identified where is the particular place for growth of the this type of roundworms means in the human being, especially that is the lumen of small intestine. Okay, in the human body, especially the lumen of small intestine is mainly favorable part for growth and replication of the this type of roundworms. Okay, next we are going to discuss about what is the epidemiology. Okay, epidemiology for the roundworms. Okay, first in that epidemiology what we are identified means what is the causative organism, what are the best source of infection. Okay, what is the infective material or how the disease will be transmitted to the one person to another person. Okay, in this we are identified especially the agent is the Ascariasis lumbricoides. Okay, it is the most agent for the cause of this type of helminthic infections in the children's. Okay, next one is host. Okay, in this host especially the man is the main source. Okay, now in this man only the infection will be easily spread, especially preschool children may be prone to get this type of disease. Okay, preschool before going to the school children. Okay, in that 1 to 3 years of age group children may be prone to get this type of infection. Why? Because due to the unhygienic practice for the disposal of excreta. Okay, there is no proper hygienic practices for the children for excretion of stool. Okay, next one is infective materials. Okay, what are the infective materials for the cause of these infections means, in these the infective materials like feces, especially feces nothing but waste products. After digestion of food, some body will be excreted some wastage from the body through the anus. Okay, that one we are called as the feces or the stool. Okay, in these feces containing some eggs. Okay, na, in the feces containing some eggs behalf of this type of roundworms. Why? Because the roundworms is there in the small intestine or lumen of the intestine of the children. Okay, that's why in that feces having the some eggs like which is releases from the roundworms. Okay, due to this the infections will be easily spread to the one person to another person. Okay, next mode of transmission. Okay, in this mode of transmission, which is the way for cause of disease, means fecal-oral route. Okay, especially fecal-oral route. In this what happens means injection of infective eggs. Okay, injection of infective eggs. Due to this the food or the soil or drink by the contaminated hands and fingers. For example, the children, for example the preschool child is there, he excreted stool or the feces in the open area. Okay, in that open area already the child will be suffering with the roundworm infection. Okay, due to that what happens means the roundworms will be releases some eggs. Okay, the eggs will be excreted external environment through the stool or feces in the children's. Okay, the child will be excreted in the outside or the open area. Okay, in that open area drainage system what happens means when the children will be excreted that particular stool. Okay, the stool having the some eggs, the eggs will be released from the roundworms. Okay, after that what happens means the child will be playing with that particular surrounding soil, or sometimes the child will be excreted stool in front of the some drinking water or some. Okay, what is useful for the human beings, that useful items or the particular useful equipment having the some touch regarding this type of eggs. Okay, due to this what happens means the child not follow the hygienic practices. Why? Because the child is playing with that particular soil or the mud, or he is drinking water with the following unhygienic practices. Okay, again the eggs will be easily enters through the mouth into the digestive system. After that the infection will be increases their growth and development. Okay, due to this fecal-oral route, once the body will get some infection due to the roundworms, after that the infective eggs will be releases into the external environment. Again the external environment containing some type of infectives or the infectious. Okay, these roundworms will be again reached to the digestive system of the children. Means as a cycle wise or as a clockwise, the infection will be easily spreading to the one person to another person. Okay, this is the transmission of infection. Okay, next we are going to discuss about clinical manifestations. Okay, what are the clinical manifestations for the roundworm infections? Okay, in these clinical manifestations, especially first asymptomatic. Okay, certain period there is no symptoms for the children who are suffering with the this type of helminthic infections. Okay, in that what happens means the child will be healthy look like, but he having some infection by the roundworms. Means a certain period there is no symptoms, we are not appearance or identified on the particular children. Okay, some general weakness we are identified children. Next sometimes anemia. Okay, the blood loss will be identified in the children who are suffering with the helminthic infections. Okay, next one is the loss of appetite. Okay, the children who are suffering with this type of helminthic infections, okay, those children are not having good appetite. Okay, they are refuse the food or they are avoiding the food material. Okay, next pain in the abdomen. When we are identified the children will complain some pain on the abdomen. Okay, next nausea, and sometimes the child will be suffering with the respiratory symptom, that is the cough. Okay, next weight loss we are identified. Why? Because the children is not taking sufficient food to the body. Okay, that's why the children will have the weight loss. Okay, next one is the growth failure. Okay, who are having this type of helminthic infections, those children are having the failure in their growth, means their height, their weight, there is no normal measurements for the children. Why? Because they are suffering with the some type of infection, that is the roundworms. Okay, next another one is the vitamin deficiency we are identified. Okay, mainly the children will be showing some clinical manifestations or symptoms like vitamin deficiency. Okay, next worm in stools. Okay, sometimes when we are identified stool which is excreted by the children, okay, in that particular stool we are identified some roundworms. Okay, due to that the child will be having this type of infections we are identified. Okay, sometimes the child having the vomitings. Okay, these are the clinical manifestations we are identified whose children are suffering with the roundworm infections. Okay, next we are going to discuss about management. Okay, what are the management for the this type of helminthic infections means, especially we have discussed medical management for the helminthic infections. Okay, in that medical management first we are administer the anti-helminthic drugs. Okay, anti-helminthic drugs we are administer the children who are suffering with the helminthic infections. Okay, in that especially albendazole or mebendazole. Okay, these are the tablets for the children who are suffering with the helminthic infections. Okay, in this the albendazole or the mebendazole, these two tablets daily for 3 days. Okay, daily 2 tablets we are administered to the children up to 3 days. Okay, for reducing this type of infections in the children. Okay, next another one is the one drug is there, that is the piperazine citrate. Okay, piperazine citrate, these drugs we are administered to the children for control of helminthic infections in the children. Okay.